we are pleased to have you here as we talk more about Lacor Hospital, also registered as St. Mary's Hospital, Lacor, which is the largest private not-for-profit facility in Uganda, especially the church-funded. This facility, as you all know, was started by the Comboni missionaries in 1959 as a dispensary, but it grew. To date, it is a 482-bed hospital. So we expect that we will maintain this for some time. We do not have plans to change these numbers yet. But the hospital is also supported by 3 of its peripheral health centers. And these are decentralized service points for the hospital. They are not a standalone facility. We have Pabo, Amor, and Opit having our branches there. Each of them has 24 beds. But always they admit and treat more than the numbers we had planned for because the population needs services. As a hospital, the Lacor complex, I would call it, when I talk of the Lacor complex, we mean the hospital, the 3 health centers, and the training institute that we hold. Our core mission remains focused on providing affordable, quality, and sustainable healthcare to the needy, and to train professionals of high integrity in witness of the church concern for all. Remember, we are a church-funded facility. And this is aligned with Uganda's national health priorities, looking and not forgetting of the Sustainable Development Goal. The vision of this hospital is to be a hospital of choice. Mark that word, to be a hospital of choice, providing quality, sustainable care in a humane and supportive environment. Now, we as the hospital have values, and our values emphasize patient-centered care, patient first, respect, integrity, teamwork and staff development, and active community engagement. And that is why you are here. We, every year, do analyze our performance as a hospital, and of course share in the form of annual hospital reports, which is accessible online. You can download and go through. For the past 1 year, we are looking at the financial year 2023-2024, because 2024-2025 is yet to end, and so you cannot talk about it in details. Of course, as a hospital, we achieved a number of things. Our purpose is to treat patients, and so in the year 2023-2024, we managed to treat a total of 189,000 patient contacts. And of course, that is outpatient. Now, inpatient admission also significantly increased, especially among children, by 17%. And neonates, these are young ones who are born and have not finished 28 days, have not gone beyond 28 days of their life, 103%. See that increase. Maternal and child health services remain strong in the hospital, with over 8,800 deliveries, and maternal mortality ratio was at 183 per 100 live births. You know the national is 189 per 100,000 live births. So we are not doing so badly compared to the national standard as of now. We effectively managed major health issues in this hospital, and that's part of our care. We treated malaria, sickle cell disease, HIV, and cancers, including screening of over 1,000 women for cervical cancer. And this is one of the silent killers in the society today. We have a functional laboratory, and for that year, the diagnostic services conducted over 505,000 tests, supporting accurate diagnosis. Without the laboratory, the prescribers will take time to make decisions, but it is very supportive for them. We also do surgeries in this hospital, and we can actually note in that report that we had over 6,100 major surgeries which were performed in this hospital. 6,100 major surgeries performed in this hospital, including regional leading cesarean section, which approximately stands at 24.7%, we make it 25 for this hospital. That is women who deliver by surgery in this hospital. We also do not handle only curative services, but we do extend to health promotion and disease prevention. And our community outreaches and outreach programs in immunization, HIV services, health education, and epidemic preparedness continued to serve the community effectively. Our team go to the community, they reach there and provide these services integratedly. For staffing, we recruited critical staff and expanded staff housing. The project is almost concluding. We are doing well there. Strengthened the hospital safety, infection control, and research. Hope we shall continue in that positive direction. But with all those positives that I made mention, you can't go without mentioning some challenges. The most important one is the rising costs. The rising costs in all areas, dependence on donor funding and limited government support pose financial challenges to this hospital. Those are the key areas: rising costs, dependence on donor funding, and then limited government funding. We also have another challenge. Staff retention remains a concern due to brain drain and rising expectations. You know, the government increased salaries of health workers, but that is government. This is a private, not-for-profit hospital. Someone would call it a loss-making hospital. If you're not, you're not for profit, then you're for what? You can't say. But we focus on service first. Infrastructure gaps, especially in waste management and IT capacity, require ongoing attention, and this is an area that we keep focusing at. Other external factors, such as economic instability, climate issues, and security threats, impact service delivery. We said we are highly donor dependent, so if there is insecurity or any other economic instability in the donor country, in the countries where our donors are, then automatically we get affected. We still have to struggle improving data collection and reporting. That is an ongoing challenge that we will have to handle. But going forward, the hospital will focus on strengthening core services. It has a 5-year strategic plan that ends in the year 2027. So this is strategic plan 2022-2027. And then after that, we review progress and rethink of how we can proceed, probably by developing another strategic plan. Currently, in that strategic plan we are focusing on strengthening core services, emphasizing health promotion and disease prevention. and then reaching out to the community. We must be with the community and they should feel our services. So we aim to expand diagnostic and surgical capacities, sustainability, and then maintaining affordability and prioritizing vulnerable groups. As per our mission, we must be affordable and we must look at the vulnerable groups. Someone will ask, how affordable are you? When we come later, if the question comes. Staff training and welfare will be prioritized as per the strategic plan. Infrastructure upgrade, environmentally friendly energy solutions, and waste management improvements are ongoing, and we will continue with surveillance activities. Cancer registry efforts. We have a cancer registry based in Lacor Hospital, the regional cancer registry. And we will continue to collaborate in research activities to inform policy and improve care. Not forgetting commitment to quality of care, Lacor Hospital remains dedicated to quality improvement through regular quality assessment internally in the hospital. We do provide space for patient feedback. This is through patient satisfaction survey, which is done routinely in this hospital. Issues regarding infection control. We have a very functional committee in the hospital. So if you come with your malaria, you should not go back with another infection from the hospital. So they work very hard to make sure that when you come for surgery, you complete your surgery and go back home healthy. Staff training, of course, we continuously provide this training, and our current patient satisfaction rates is over 98%. That is the latest. We have just concluded one patient satisfaction survey, and we noted that majority of our clients are actually satisfied with our services. An overwhelming number is satisfied, reflecting our commitment to excellence. Conclusively, we reaffirm Lacor Hospital's unwavering commitment to serve our community and improve health outcomes. And also we call upon the government, partners, and the community to continue supporting us. If we say community, you are part of the community. The press, to continue supporting us, especially in the resource mobilization and policy advocacy. So we invite everyone to visit Lacor Hospital.
Yes, I will not repeat what my colleagues have mentioned. They have hinted on quite a lot of things that are affecting the hospital. But I would like to take us back a bit. The hospital's mission is closely tied to the socioeconomic status of this region. If you all remember the report that was released by the Uganda Bureau of Statistics 2023, Northern Uganda ranked as one of the poorest regions in the country. And health and poverty, there's a very bad mismatch between the two. So Lacor's hospital, its mission, if you look at the mission that my colleague mentioned earlier, is interlinked with that. For those who believe in the Bible says, bear each other's burden so that you can fulfill the mission of Christ. That is in Galatians 6:2. So what Lacor is trying to do, we are taking that burden out. If you have a very sick community, they won't be able to attain their full maximum potential and productivity, meaning that this burden is spread out throughout the entire family. Just to give you a snapshot, if you have a head of the family who is sick, what do you expect of the children? So the cycle of poverty continues. So this is where Lacor is positioned. We want to take care of that burden, but also with the support that the other partners give us, so that we can carry that mission forward and also help the socioeconomic status of Northern Uganda to be able to be productive and contribute meaningfully to the national development of our country. Now, with that said, I want to mention something small that he had hinted on. Besides these services that we give to our patients, we are also a teaching hospital. Teaching hospitals by the National Council of Higher Education means these are tertiary facilities. So we have a number of universities that are affiliated to us. We have Bull University. He has mentioned they are now offering masters and also undergraduate medical programs that are taught within the Lacor campus. We also have Kawale University, who also have their students here. We have Busitema University, and also we have collaborations with a number of foreign-based universities. I think Professor mentioned earlier on, yes, from Europe. So that also helps us in fostering partnerships, collaboration, sharing knowledge, and improving care, because the end goal is this hospital, at the very center of it, is the patient. It's a community-based hospital, so it's the patient. So all these collaborations are geared towards that one mission, that one goal. So that means we have to reach out to all the partners. Also, we have the Uganda Allied Health Institutes. We also have the Lacor Training Institutes, where we have those who are training to be nurses, midwives, and also laboratory technicians. They also, this is one of their training centers. Now, I want to take our attention to the current epidemic that we are seeing. That is road traffic accidents. I am the head of accident and emergency in Lacor, and we are seeing an increase in this. And we are all very familiar with the borders. I'm certain quite a number of you came to the hospital without helmets. Some of you, yeah. So this is it's a big challenge, and fortunately we happen to be one of the hospitals that is able to manage some of the neurotrauma cases, and the increase is it's significant. But what I want to say is that we need to strengthen the ambulance coordination. Within the Lacor network, we have ambulance services that are now coordinating all the peripheral facilities, but also out there. The way patients reach the hospital, this is an area that we need to improve. Sometimes the injury can't be reversed once you reach the hospital, but the process how the patients are transported, that is the one which is really, really bothering me. And also we need the other stakeholders to be involved, the police, the traffic, even you as an individual, you also have to take responsibility so that this message reaches out there. Because I'll give you the economic burden of that problem. You are the breadwinner. You're injured, you're brought to the Lacor hospital. And one of the diagnostics that we use for head injury is a CT scan. We don't have a CT scan. 5 years ago, there was a presidential pledge to aid us in obtaining one of the CT scans. Unfortunately, to this day, there's no answer. I hope you will ask on our behalf what is happening, because it helps us to give timely care. Head injury is not like any other injury. There is a time factor associated with it. And this also has an overall outcome on prognosis. So it's something that is very timely, and it's, like as mentioned, we are in the age of technology and health. The two are being married together. Those of you who are very familiar, we are seeing the role of AIs, high-end tech, all the things are being incorporated into medical care. Now, we also have to try as much as possible and lean and also help to improve the patients. So this is something that we really, really need to have in the hospital.